Hello, everybody. Welcome. I'm Lisa Lunghofer. I'm the Executive Director of the Gray Muzzle Organization, and I'm joined today by my colleague, Amanda Grant. We are thrilled to have Pam Holt here with us today. She is going to teach us about canine massage, and I'm really excited to learn. So, before we get started with my introduction of Pam, I just wanted to mention that we will take your questions. If you're joining on Facebook Live, you can type your questions into the comment box. If you are joining via Zoom, you can enter your questions in the chat box. All right, so with that, Pam Holt of Buddha Dog Animal Massage is a registered veterinary technician and has been a certified animal massage therapist since 2003. She provides home sessions in the Los Angeles, California area that include massage, acupressure, and Tellington Touch. She's the proud mom to many rescued dogs and cats of all ages, and you can learn more about her and her practice at buddhadog.com. All right, with that, I will turn the floor over to you, Pam.
Hello, everybody. I just want to thank Lisa and Amanda, Denise, and everyone at the Gray Muzzle Organization for having me and for everything that they do. They are my heroes for sure. This is my dog, Bogart. Say hi, Bogart. Say hi. He is estimated to be about 15 or 16, but he's been with us 12 years, and he's a real good boy. But as you can imagine, massage is really good for everybody, but especially seniors. It can, what it does is it increases circulation of blood, lymph, and nutrients to the tissues, which can prevent injury, which can help injuries heal faster, and just kind of enhance every organ system of the body. And it's also just a really good thing to do with your own dog, just to know what feels normal for them. And that way you can find abnormalities a lot faster. So, you want to kind of set the scene, and I have him on his side like this, so I have easy access to his limbs. But I don't force the dogs into any position. I let them, sorry, my screen went off. I let them be comfortable as they are, and I don't force them. I just kind of gently try to coax them on their side. So I have a pillow underneath his neck to support his neck, and then I have this pillow here between his knees. As they lose muscle tone when they get older, putting something soft between their legs and their front legs also. It's really helpful for them. It's more comfortable, like how we like to have a knee pillow sometimes, but that helps with comfort. And so you want to make sure they relieve themselves first so that they're comfortable. And definitely after the massage, they need to relieve themselves, because you'll be loosening up toxins, and you want them to be eliminated. So fresh water beforehand, sometimes during and afterwards, is really important to help flush those toxins out that you're going to be loosening up from the muscles and other parts of the body. So massage is really good for helping to, even as just a pain reliever, a natural pain reliever. Even the lightest massage will release endorphins, the body's natural pain reliever. So that's one of the wonderful benefits. We're also going to be increasing flexibility. We're bringing more circulation to the joints, and then after the massage, we'll do stretches, and that's going to help open up the joint spaces, allow more joint fluid to be produced, and kind of straightening out the muscle fibers, because what we're doing with massage is actually passive exercise. We're pumping the blood through the muscles. So the stretching kind of straightens out those muscle fibers again, and stretching is just a really good thing. Sometimes the dogs are not active enough to keep the circulation in their joints that they need to. So we can help them out with that. And it's something we can all do. And it's a nice bonding thing with your animal too. Especially, you know, when you first adopt them, it's a really nice way to kind of speed up that precious bond that is so important with our dog. But so I'll start out doing this effleurage, and this just kind of warms up the whole body. You don't want to start the deeper massage right away. You have to warm up first because the muscles will have a protective reflex, and that's really, you know, not what we are desiring. We want relaxation. So what we'll be talking about also is acupressure, which is like acupuncture but with digital pressure, which I feel like our fingers have more energy than needles do. Although I love acupuncture, it does wonderful things. But I think acupressure is really nice too. We can do that ourselves. But the acupressure points are on what we call meridians, which are kind of energy channels throughout our body. And there's different meridians named for all the different organ systems. So when I start the massage, I go along the bladder meridian, which is the longest meridian of the body. And there's two branches on each side of the spine. And along the bladder meridian are the association points for all the organ systems. So going along that bladder meridian helps kind of relax them. I'm going just all the way down the spine. And you can kind of enhance all the different organ systems of these association points that you're going across. So I'm starting at the head, going down the body, down the spine, and I'm ending up here, which is one of my favorite acupressure points, the skinny part of the ankle between the bone and the tendon. It's on the bladder meridian. It's bladder 60. Each point has a number, and it's also called the aspirin point. It's actually a long point. It's on the outside, and so I just go up and down that point, and that's good for relaxing muscles and relieving pain. On the inside is actually an important kidney point, so you can do them both at the same time. So I've done 3 passes to begin with, and then it will end with 3 passes on the bladder meridian also. So I'm just kind of like warming everything up, and you're also palpating. You're checking for spots of heat or spots of cold. You know, if you're feeling heat, that could be inflammation. If you're feeling cold, that means there's not enough circulation in that area. So you want to be sure and get circulation going to that area. So you almost imagine painting the dog. So you cover every spot. And if you're having a hard time getting them to relax, there are things you can do. This yin tong is right here at the nose, and a lot of people do this just instinctively to relax them, but this is a nice relaxation point, just kind of gently stroking the bridge of the nose. I go along his mouth for the stomach meridian, but also I have a booklet on my website that tells you where the different meridians are, so you know what organ systems you're stimulating, depending on what part of the body. But the ears are so very important. I'm sure you all know most dogs love their ears stroked just gently, as if you're stroking a rose petal. There's actually, the ear is a hologram for the whole body, so just stroking it can affect. It's usually very good for relaxation. If they have a hard time relaxing, sometimes a nice walk beforehand will expend their energy. And like I said, it's also good for them to empty their bladder and their bowels and make sure they're comfortable. So a walk is a good idea beforehand, just for a few reasons. Is to get them tired. You know, a tired dog is a good dog, but usually our older dogs don't have a problem relaxing, and they get what's going on pretty quickly. But so just also they hold tension in their jaws just like we do, and so massaging their jaw can be relaxing for them too. So I'm doing this small circles. Hopefully everybody is familiar with Tellington Touch, TTouch. It's a form of acupressure. And the foundation is just doing 1 1/4 circles, like the size of a quarter. The circles are the same principle as with acupressure. When you go clockwise with circles, it strengthens, and counterclockwise sedates. So like if you were to find a warm area, it needs sedation, so you would go counterclockwise. But sometimes you just trust your fingers and they'll go the other way and you just kind of trust them. But so for the, the TTouch, Tellington Touch, you picture a small clock face and you start down at 6 and you go round past 6 to 8. And then you pick up your fingers and you move to the next spot. And you can just do this randomly all over the body. Or you can do it in a trouble area, say a shoulder joint, around the shoulder joint, or a hip joint. But this does, it just kind of like wakes up the neurons and kind of activates the cells, and it does wonders for mental and physical changes. But I just love TTouch. There's lots of TTouches. You can go to TTouch.com and learn more about that. And if you download my booklet, I've got a few pages on TTouch. But I just love it. And TTouch also has a hair slides, is what they call it. And you kind of like pick up the hair and slide to the end, and that's super relaxing for them. And you know, you just kind of find what they like, and if they get a little restless, you go back to what you know they like. Say they like the neck massaged or the head or the ears. You know, you learn quickly what they like and what they don't like. And it's really important to operate on their feedback, to listen to them, because they will tell you if something's too hard or if it's not hard enough. I feel like my computer's going to go to sleep again. What's wrong with that? Can I just wake it up? Okay, sorry. So, so we're listening to them, and you know, if they tell us they don't want it, then we really have to respect them and try again another time. But I think you'll find most of them love it. So, so we've warmed everything up. We're you know, you're palpating for new lumps or bumps or anything. And you know, as you know, the older dogs, and older people, you know, we get all these things growing on us. So most of them are no big deal, like these little skin tag warts. You know, usually it's no big deal. You know, if it's a soft spot, it's usually just fat, lipoma, little fatty deposit, not to be concerned with. But if something's hard, that's more concerning. If it's kind of got an irregular shape, that's more concerning, or a strange color. And you just really keep an eye on things and make sure they're not growing really fast, which is not a good thing either, and changing color and everything. So I'm sure you're all familiar with that, but just really good to always have your hands on them, because the earlier the detection, the better. So we've warmed everything up, and then we can start with, after the effleurage. Did I say effleurage is what this is? It's kind of one hand following the other, these long gliding strokes. And so we'll start off with effleurage, and we'll continue effleurage throughout the massage, because once we start what's called petrissage, the deeper massage, the kneading and getting in there deeper, we're going to be loosening up the toxins, the lactic acid that we want to be eliminated. So we'll use this effleurage to do that, to help eliminate, like, you know, when you have lactic acid that stays in the muscle, that's what makes our muscle sore. So you don't want it to stay. After you work an area, you do the effleurage to help it get eliminated, which is another great thing that massage is for, is to increase the elimination of toxins. So after they have surgery, you know, you're trying to get the anesthesia out of their system, massage will help speed up that process. So that's all good. So we can do this effleurage, and then I'm going to do a little bit of cross fiber friction. In my booklet, there's a diagram that shows the striations of the muscle, so it can show you how to go across, you know, how you can go across these fibers, so you can see the way they go. I'm using my thumb here, just kind of going across the fibers, and this helps loosen up scar tissue, things that can limit movement, adhesions. So I'm doing this all along the spine. So I'm just using this thumb motion. I'm hoping you can see what I'm doing here across the fibers. And okay, so doing this along the neck. Excuse me, Travis. Doing this all along there. Travis, come on, come on. Okay, so as I work each area is when I'll work the acupressure points, and really just even running your hand along these meridians, you're actually stimulating these acupressure points. But I just wanted to point out some of my favorite ones. First of all, there's an emergency point that everyone should be familiar with that can be helpful if the dog is unconscious. And this goes for cats too, and bunnies, and all animals. Most everything I'm going to talk about. But since we're talking about dogs today, this point is also good for if they're having a seizure or some kind of emergency, like on the way to the emergency clinic. You can just stroke this area here. It's kind of like right here right under the nose here. Just do gentle strokes. This will revive, and also, I mean, like if they're having a bad dream, sometimes I'll wake them up here or at the tip of the tail. Lupita, good girl. This will kind of revive on the tip of the tail and also here. So, you know, when they don't need it, it's a little weird for them, but that's a good one to know as an emergency point, right? Just a little gentle stroking there. Okay. Also, a good point to know about is the point that stimulates the appetite, which happens to be right here where the fur meets the nose. Lupita, where the fur meets the nose right here. So I'm right here. So I just do a little gentle, kind of almost, you know, gentle scratching. Lupita, little gentle scratching. That can help stimulate the appetite. So we talked about yin tongue, the relaxation point at the bridge of the nose here. Another point I like is that there's two indentations, two little dimples at the base of the skull below the occiput, and that can help release tension. It's also good for seizure activity. Your fingers kind of fit right in those little dimples there. I should have them turned around to really show you, but it's really easy to find behind there. Okay, and also the master point for the head, neck, and face. You know, it's the same as with us when we have a headache right here. It's in the web of the dew claw here, so you don't want to pinch this. You don't want to pinch the skin there, but I just kind of do a little stroking here. Come on, Lupita. Good girl. So that's a good one to, it's a master point there. Also, a good point for older dogs is the anti-inflammatory point right here. Um, it's lung 11, or okay, right here in the crease of the elbow, um, right at the top here, when the elbow is flexed. So with these points, we can just do gentle digital pressure, or you can do, come on, baby, a pulsating, like pulsating motion, or those circles that I talked about, and counter or clockwise strengthens, counterclockwise sedates. It just, or just a gentle little massage in there. So usually we're looking for release. What we're doing with these points is there can be the chi that flows through these meridians, through these energy pathways, can get stuck, and that's where disease happens. So we're trying to release these blockages that may be there. They may not be there, but they may be there. So we're looking for a release. Now, that could have been a release, what he just did, or a big sigh, or a sneeze, or even like passing gas, or there's just all kinds of things, which that's a big byproduct of giving them a massage is they may pass gas, and it's a good thing. It's a good thing to release. So we're looking for a release. You may not see a release, but you can just hold it for like 15 to 30 seconds maybe, or massage it for that long. But ideally, if there's a blockage, we want to see a release when we're working these points. And sometimes they just, get up, or, there's just all kinds of different ways for them to release. So we're just kind of looking for that. So going down here, and also there are acupressure points around every joint. In my booklet, I have a little diagram showing the basic pattern of the acupressure points. And so around the elbow, around the wrist, around the shoulder, hip, knee, or stifle, ankle, or hock, acupressure points all there. So you're always stimulating when you're massaging around the joints. And the joints, you want to just do this gentle fingertip massage. Sorry, my computer's going to go to sleep again. I don't know why that's happening. I apologize. So, I'm doing this TTouch around all the joints, stimulating those acupressure points. We're really concentrating on the joints with the older dogs. Excuse me. So the hip joint and the knee joint, they both have acupressure points on both sides and at the top, like a triangle. And just putting your hand on these, just putting your hand on these will stimulate those acupressure points. But if you want to hold it, you get in front of the hip joint and back of the hip joint and at the top of the hip joint. So we're just kind of like gently squeezing. Not really squeezing, I'm just kind of like, you're using such light pressure, really light pressure. And the TTouch around all the joints is great. Those 3 spots here. With the knee, like Bogart, like so many dogs, has torn his ligaments on both knees. One before I knew him and one after I knew him, but which is so common for the other one to go. So the master point for the hind end is in the back of the knee, right here at the popliteal or popliteal fossa, where the popliteal or popliteal, however you want to pronounce it, I've heard both. The lymph node is right here. And of course, the lymph nodes are really important health indicators that massage helps you check. So in my booklet, I've put a diagram of where all the lymph nodes are, so you can kind of know what they feel like normally. This this one feels like a little pea. You can barely feel it, but if it were to be enlarged, I could definitely feel it real good. But that is where the master point for the hind end is, to help strengthen the hind end. So when I'm working on the knee, I will hold that point while I'm doing both sides of the knee and the top. Of course, it's a stifle with the dog, but you can still call it a knee. So I'm holding those points in a triangle, and he had a little bit of a spasm, so that may have been the release we were looking for. There's another one, but I think that'll do for him. I also love this master point for the GI system. It's a long point. It's on this tibia muscle. It's the muscle that's on the tibia right here. Here's the knee, and you just go below the knee. Sorry, below the knee on the side here. I just kind of stroke that down. And this point, you know, if there's diarrhea, vomiting, nauseousness, any kind of GI problem, I would work this point. But this is also a good point for arthritis. Right next to that point, at the head of the fibula, is a point that it's gallbladder 34. It strengthens the tendons and ligaments in the body. So that's a really good one for knee injuries. It's just this one right here. On skinny dogs, you can really feel the head of the fibula better. And we've talked about this bladder 60, this aspirin point, which I love. The first kidney point is right here below the pad. And working this point, which, you know, just rubbing, easy to work these points. It's not a hard thing to do, but this helps to ground them. So that's really helpful for lots of dogs. There's a little release there. And let's see, okay. So those are just some of my favorites. I may point out some other favorites as I go along. But I think maybe we can start. Jessie. Sorry, come on, baby, good girl. So we've warmed everything up, you know, doing TTouch, working the acupressure points. Now we can start a little deeper massage, which is called petrissage. So we are going to actually, you know, kind of pick up and knead the muscle. The neck is the best place for doing it. And they usually love it. And so, you know, the chest muscles, kind of going all around the shoulder joint and working this, all the muscles. Now, you don't want to massage on the bone. That's not comfortable. There is a meridian that runs along the spine, and sometimes you work those acupressure points, but generally we're just going for the soft spots where the soft tissue is. And what is really good about petrissage for older dogs is because they do lose a lot of muscle tone. The muscles atrophy from not using them as much. So we can actually exercise for them. Like I said, this is passive exercise. So I'm really pumping the blood and the lymph and the nutrients through the muscles here and kind of tricking them into thinking that they're exercising. So we can really get this going here, and the muscle thinks they're getting a workout. And remember I said after this petrissage, we have to do the effleurage. And I'm also doing a little compression here. I want to make sure we move all of those toxins, lactic acid and everything. So this compression I'm doing, I'm putting my hand underneath his leg and I'm really compressing the muscle. Get those toxins out. Get them out there. Get them out. Here, just squeeze them right out of the muscle there. Like that. Okay. Okay. And I like also what's called joint compression. And I do the after the stretches, but I also do it while I'm massaging. I'll just kind of put one hand on one side of the joint, one hand on the other, and you squeeze it together. You really get circulation where it needs to go. This can help pain relief, but it really, you need to have circulation in the joints to keep them lubricated and in the best shape they can be. So, we do the lumbar muscles, some petrissage here. Good boy. And you always want to speak to them, acknowledge them, listen to them, look at them. You say, good boy, reassuring things, speaking very softly and lovingly. And also, it's really important what is on your mind, because once you touch them, they're kind of feeding off of your energy. So you want to make sure you're saying positive, that you're just thinking good thoughts for them and healing thoughts, and just kind of seeing a healing energy around them. I use Reiki, which is a Japanese energy healing, and animals really respond to it. So if any of you Reiki or are thinking about it, it's a wonderful thing for the animals. So I just get the Reiki energy flowing before the massage, and I keep it going throughout, and the animals really seem to respond to that. So that's just another thing to keep in mind. If you get that thought in your mind, just let it go. Keep your breathing nice and deep, and almost try to match their breathing if you can. And this whole experience is just supposed to be very relaxing and healing for you both. It lowers our blood pressure too, just giving them a massage. So there's a lot of benefits to be reaped. So I encourage you to take advantage of that. So so we're done the deeper massage. We're getting the blood flowing here. The abdominal massage, he gets a little itchy. But just to kind of show you, if say they are constipated, you can kind of push things along. I think my computer's going to fall asleep again. I'm not sure why it's doing that. I'm so sorry. So we can try to help keep them regular by going up the ascending colon, across the transverse colon, and down the descending colon. Sometimes you can feel, luckily he's gone this morning, so he doesn't have anything in there, but this is a nice thing to do there. And he gets a little itchy there. Okay. And so we're gonna do the crossfire friction and petrissage, and get this muscle in effleurage. And so I usually do the stretches after each section that I've done, just because you want them to be warmed up before you start the stretches. You never start stretching them without warming them up first, or it's not as beneficial, and you can also hurt them. And if they resist the stretches, you don't want to defeat the purpose, so you can't push them. They are really the boss, But before we start the stretches, I think I might talk about the other parts of petrissage, which is like skin rolling, kind of wringing out also. So sorry, should have them the other way when I'm showing this, but I'm going to do a skin roll along the spine. I'll show it here, where you just kind of walk your fingers. You take a loose skin and you walk your fingers. This is great for releasing adhesions and scar tissue. So I'm going to try to do it where you can see, but I'm walking my fingers, rolling the skin. There. Do it here too. And this is a nice thing. It feels nice too, I think. It gets a little sensitive. So also for wringing, I'm going to wring out the back muscles by one hand going one way and one hand going the other way, as if you're wringing out a garment. This is really squeezing those toxins out. So I go one way, the other way, on the spine. Then I'm going to do the opposite way, along his spine. And lots of effleurage after that. So, everything worked up. We've done our effleurage, our cross fiber friction, petrissage, acupressure points, TTouch, and I guess I can start some stretching. So, like I said, get everything warmed up. I'm doing that master point for the head, neck, and face there. Do all the digits, you know, massage all the digits. A good thing, you know, older dogs, they start, you know, kind of their back foot pod knuckles out, and you know, anyway, you test for proprioception to make sure everything's going there good. It's kind of a neurological thing, but if we it can be very ticklish, but if we stimulate this in between the toes like this really pretty intensely, that can prevent some of that, you know, not being able to right their paw. Like, just keep these toes stimulated there. So just I'm working in the toes here, and most of them are ticklish like that and will kick, but it's really important to keep that stimulation. Some vets will say to actually pinch the webbing, which, you know, I think is not nice, and some of them don't like it a lot, but it is a helpful thing when you're like checking for feeling, like, can they feel this, you know? So just a gentle, and they should pull back like that. So I'm just a gentle pinch and pull, and they're pulling back, and that's the reaction that you want. You want to make sure that they can feel everything. So I'm going to stimulate the toes, and then we're going to start the stretching. So I'm going to flex the toes back and forward, and I'll do this 5 times. Stretching the toes out. Then I will flex the wrist or the carpus. Here's another acupressure point I really like, heart 6, this big cavity here. This can relax the heart. So I just kind of put my finger in there as I'm flexing the wrist 5 times. And this is where I'll do that joint compression. I'll push, push, push the joint together, get that circulation where it needs to go there, and then little TTouch circles. And the elbow, you want to stimulate it with this gentle fingertip massage. And then I'll go ahead and do that anti-inflammatory, and I'll flex 5 times. So this is large intestine 11. Large intestine 4 is the master point. And then I'll do that joint compression, push it together 5 times. And then I'll do this petrissage. Joint compression of the shoulder joint is really good. Pushing it together, pushing it together. I'll go ahead and go all around the shoulder joint before I'm going to stretch it out. And so gently, I'll bring the front leg forward to stretch out the shoulder. I'm putting my arm under to support the whole leg, but you want to definitely support both sides of the joint. A lot of dogs will resist this, and you just kind of have to maybe go back before you go forward, but he's not resisting. So I hold it about 8 seconds, 5 times. As long as there's no resistance, you never want to go past the point of resistance or keep going if they resist, because that's not what we're looking for here. So I've done that 5 times. Then I kind of open up the chest a couple of times. He's kind of resisting that. And then I'm going to bring this back to stretch out the deltoid and the bicep. Hold that for 8 seconds. And you're always staying on the straight line. You're never going any unnatural direction. We're just keeping it close to the body. You have to breathe, and they'll breathe. Good boy. And lots of encouragement. So I'm holding for 8 seconds. I'm doing this 5 times. And then I'm going to do a range of motion, giving lots of support, keeping it just on that natural line. And I do, what I call the doggy paddle. And I usually will do this about 12 times, unless they don't want to do it. And going just the full range of motion. Full range of motion. If a dog's immobile, you can do, up to 25 times. And then I pull it out and I kind of give it a little vibration, a little shake there. Good boy. Also, the lymph nodes here, some older dogs can get lymphedema where there's, an obstruction in the lymph nodes because they're not exercising as much. And that's really how the lymph nodes get drained, is just that motion. And so a lot of times they can use a little help, just a couple of squeezes to pump those lymph nodes that maybe aren't getting pumped as much as they were when they were younger. And then just use this effleurage to clear it all out, clear out that lymph. And then, I'm going to stretch this, and then I'll go back to what normally I do each section, but I'll just we're working on stretches now, so I will go to the back leg, stretch those toes out, get them all warmed up first. You running your finger along each digit, stimulating the inside between the toes. So I'm going to flex forward and back 5 times. And then flex the ankle or the hock. And my computer's going to fall asleep. I'm so sorry. Okay. So after I've flexed the hock, then the ankle, I'm going to do the joint compression, push that in, 4, 5. Flex the knee with lots of support, Sometimes if you hear a little click, that could mean they're predisposed to a ligament injury, or, you can feel the thickening of a knee is kind of the indication of arthritis within that knee. The scar tissue that builds up, and the bones actually calcify to provide more support. So that's kind of an indicator of a ligament injury or arthritis. So I flex this 5 times, and then I'm going to push the joint together on both sides, get that circulation where it needs to go. And then I do, this is an exercise for kind of a rehab after a ligament injury, but I like to do it for dogs and call them doggy squats, where I'm just I hope you can see what I'm doing, but the knee is bent, the hock is bent, the ankle's bent, and I'm bringing it to the body. And I'm going to go the first five I go slow, 3, 4, 5, and then I do 10 more faster, 7, 8, 9, 10, 11, 12, 13, 14, 15. I feel like that's a good workout. And after I've done the other side, I do both legs together too. So I'm going to do a little more petrissage while I'm here, and effleurage. And then you get into the groin muscle there. You really work that. Some dogs, it can get really tight in that area. So I'm going to stretch out the hamstrings, which can get really tight on a lot of dogs, or the butt muscles. So I'm supporting the whole leg, bringing it slowly forward. Hold for 8 seconds and bring it back. And I do this 5 times. And bring it back. And so I've done that 5 times, and then I'm gonna, I don't know if this is getting in the way to see. Then I'm gonna open up the hips, which can be a little harder for some older dogs. Just do that a couple of times. Open up the hips. And then I'm gonna slowly bring it back. I just gently push the knee, and a lot of dogs will do this stretch on their own, which is great. So we're gonna stretch it back, and this stretches out the pelvis and the knee. He's not doing it himself, but good boy. So holding for 8 seconds, doing 5 times each. Good boy. And then after 5 times, is that okay? Oh, the baby. Is that okay? Good boy. You know, of course, if they resist, you can't force them to do it. You don't want to force them to do anything. But after 5 of 8 second holds, I'm going to do the range of motion here. And usually I'll do this 12 times, but for dogs that are not as mobile, I might go up to 25 just to kind of exercise their legs more. So I call this riding the doggy bicycle. And then after I've done 12, I do a couple or maybe 5 more of these doggy squats. And that's good. Then lots of effleurage. And I'll do the joint compression of the hip. Oh, I'm sorry. I think I've run over here a little bit. So I'll finish up quickly. So we've done this. What I like to do also is called the nerve stroke, where you kind of drag your fingers. It's the same principle as brushing or combing them, but it stimulates the nerve. So I'm doing that. A lot of times this will cause the dog to stretch out, which is great. He's not doing it today. So nerve stroke, and then we'll do tapotement or coupage, kind of like you've got a cup, and here, if a dog has any chest congestion, this is a great thing to loosen up the phlegm on their chest. It's stimulating, so he's waking up now. Good boy. And lots of effleurage. And then I'll do the 3 passes along the bottom meridian again to close this side. And then I'll do what's called passive touch, where you just, well, before I'll do a little fingertip tapotement first. And then this passive touch, you're just thinking the most wonderful thoughts for your dog, how much you love them, sending them healing energy, just with all good intentions, without any pressure or movement. Just, and I always say, thank you, thank you, thank you. And of course, for balance, we have to do both sides. Every dog is different of how they prefer to be turned over. So I can show you a couple. I think I'll just take the front legs in one hand, the back legs in the other, and flip like this, and then you gently reassure them once they've flipped over by stroking along their spine, which is reassuring for a lot of dogs. You can also do it this way. Do you mind doing it this way, honey? Ready? This it's better for smaller dogs, but one minute, two. He's a grumbler. 2, 3, like that. Yay! And then you always reassure them with the along the spine here. Some dogs you have to let them get up themselves and turn themselves over. Some dogs can learn roll over, you know, of course. But every dog is different on what they prefer, so you just have to figure out what they prefer. And then we want to give them fresh water to flush those toxins out and take them out to urinate to pee those toxins out. And a lot of dogs, there's a lot of movement. They'll have to have a bowel movement because you've moved things around, but a nice walk to kind of balance them out is always a good idea too. Thank you. I think that's about it. I'm sorry I went a little over for leaving time for questions.
I know, that was terrific, Pam. Thank you so much. And Bogart gets a great big gold star for being such a cooperative partner to you there. That was great. I feel relaxed now.
Oh, nice.
We do have one question in our Zoom chat box. Carly asks, is there such a thing as a pressure point to help with cognitive function? As my dog ages, I've noticed her getting more confused or distracted, and I'm sure creating more blood flow in general would this help, but is there a specific point to engage?
I know there must be. Let me think. Just a lot of this work is, it just work like TTouch works with the mind also. So I think that stimulates the mind too. Shoot, I'll have to find out who asked that and get back to them because I'm sure there is. That is a really good question, but yeah, this TTouch, I would say TTouch can really help them focus and kind of sharpen their mind a little bit. Just these 1 1/4 circles, this TTouch, I don't know, it's something, it does something neurologically with their brain, but I'm sorry, I should have that because that's something that a lot of my clients deal with, but I can't think of one specific one right now, but I'm sure there is. So if I could find out who asked that to get back to them. I'm so sorry.
Absolutely. Someone else asked about whether you have suggestions for dogs that are somewhat resistant to massage. They think their dog would benefit, but they're not so keen on being touched.
That happens a lot. You just kind of have to be patient and do a little bit at a time, and maybe use treats as a reward just so they can, they can associate it with something positive that they like. But that is a concern. And sometimes dogs are so painful, so they don't want to be touched. So yeah, I would just say, a little bit of time until they associate it with a positive feeling, and maybe some treats. but that is tough, and I would say just keep trying, you know, a little bit at a time, and
Sure.
hopefully they'll realize that it's all good. Cold.
Someone else asked if you had thoughts on combining with acupuncture.
Yeah, acupuncture is always great. I mean, some dogs respond better than others, and it does take multiple treatments sometimes, usually. But yeah, a lot of my clients get acupuncture also. I mean, I do acupressure, and then they just kind of, you know, complement it with some acupuncture once a week, once a month, you know. But yeah, they definitely all go together. Yeah.
Okay. Any thoughts about working with dogs who have spinal cord injuries? Someone was asking specifically about intervertebral disc disease.
Massage is so important in that case. I've had a lot of clients with that problem. You know, you want to keep the muscles as toned as possible because they are not using them when they're, you know, in a crate rest or whatever kind of rest. So that's really important to keep the blood flowing through the muscles that aren't being used. Keep the blood flowing along the spine, between the vertebrae to speed up healing. I like to do TTouch between the vertebrae. There are acupressure points between each vertebrae, so working those. And just the pain relief that can come with the endorphin release. Doing the stretches are really important. I mean, you always want to make sure you're not doing any harm, so you want to talk to your vet or find out the exact location of the disc problem so that you are extra careful in that area. But massage is really important in that case to speed up healing and to keep the muscles toned and just provide comfort and some pain relief for them during this difficult time as they're healing. Yeah.
Right. Great. All right. Well, we are just about out of time. I want to thank you so much, Pam, for this great presentation. Thank you to Bogart. It looks like Bogart has a pal there who is next in line for his massage. Any final words from you?
No, I just thank everyone so much for being here. I thank the Gray Muzzle organization and for all the angelic work that you do, and bless you all for all you do, and lots of kisses and belly rubs to your babies.
All right. Well, thank you very much. We really appreciate you taking this time with us this afternoon. For those of you who did tune in, we will be, if you registered on Zoom, we'll be sending you a survey to get your reactions to this presentation and ideas for other topics. And we'll also be sending you a link to the recording of this presentation, which we will have posted on our website for everybody to access. All right. Well, thank you, everybody. Have a good rest of the day. Happy holidays. Take care.
Lisa, I'm
Bye-bye.
so sorry. Also, my booklet is available on my website, buddhadog.com. I'm sorry.
Terrific. Okay. So yes, so check out buddhadog.com for more information from Pam and to download the booklet that she mentioned throughout the presentation. All right. Thanks, everybody. Have a good day. Bye-bye.
Thank you. Bye, everybody. Good baby.